Hello. I'm Celeste, and this is Week by Week. On today's episode, my husband Dave and I dive into week 24 of pregnancy. And then later on, our guest is the wonderful Dr. Rachel Davidson. Let's do this. Welcome to week 24.
2-4.
You are 6 months pregnant, so that is 2-4-6.
2, 4, 6, 8. Who do we appreciate? Moms. Moms.
I stand by that message. Baby's about the size of a cantaloupe and is around 11 and a half to just under 12 inches and weighs about 1.33 pounds.
Big, tasty cantaloupe.
A little big, tasty cantaloupe.
Mm-hmm.
So, what's going on with baby? Baby's brain is rapidly growing. They're also putting on weight rapidly. The branches of the main lung are beginning to form, as well as special cells that will produce surfactant, which is necessary for the air sacs to inflate easily. They will keep developing this until around week 35. Their nostrils are opening, and they're beginning to practice breathing amniotic fluid through their nose as well as through their mouth. Their inner ear is developing their vestibular system, and that system is what helps them maintain balance in the future. Taste buds are forming, their eyelashes and eyebrows and the hair on their head is starting to fill out, but pigment hasn't developed in their hair yet. And I actually didn't know that.
So at this point, they would have unpigmented white hair.
That's right.
Interesting.
And as they're continuing to develop, they're getting more reactive to the sounds they're hearing outside of the womb.
Starting to connect to the wider world.
So what's going on with you? Your uterus is about 2 inches from your belly button. And between week 24, which is where we are now, to week 28 is when you'll likely have your glucose screening test. And that tests for gestational diabetes. Spoiler alert, I did have mine this week, but we'll get there. Gestational diabetes is a form of diabetes in which the body doesn't produce adequate amount of insulin to regulate sugar during pregnancy. Dave, why don't you read some facts about gestational diabetes?
Happy to. Gestational diabetes is typically temporary, so that is good. Signs and symptoms may be sugar in urine, which will show up in the tests that you do at your OB's office or wherever you take the test. Unusual thirst is another symptom, frequent urination, fatigue, and nausea. Approximately 2 to 5% of all expecting mothers will develop gestational diabetes. Doctors test for gestational diabetes between the 24th and 28th week because the placenta is producing large amounts of hormones that may cause insulin resistance. If the result comes back with elevated levels, further testing would be done to confirm a diagnosis of gestational diabetes. Typically, the test is done by drinking a sweet drink given to you by your healthcare provider that you have to drink in 5 minutes and then get your blood drawn within an hour after that.
Actually, like exactly an hour after
Yes.
that.
An hour later.
Mm-hmm.
If you fail the first test, they'll give you a bigger drink and you'll do basically the same thing, but this time you wait 3 hours.
Something that I didn't know about gestational diabetes that two-time recurring guest, Katie Gant, mentioned because she had gestational diabetes is that, as it says in here, gestational diabetes is connected to the placenta. And I didn't know that before we talked. So I just think that's an interesting thing about it.
You've created or grown a whole new organ in your body, and that can throw the whole rest of the system off just like any organ could.
Mm-hmm. Yeah, I don't know what is the reason, if it's your organ is overproducing hormones or what it is. But
it's a whole new part of your larger system, Yeah.
Other symptoms that are super common around this time: swollen ankles, leg cramps, backaches, tender gums, constipation, that dark line we talked about last week appearing, and stretch marks. All super common around this time. And a fun thing is you might be feeling kicks getting stronger and stronger from inside your belly. Okay, so as I mentioned, I had my gestational diabetes test this week. I had it earlier in the week. And then on Sunday around 5 p.m., we were on a walk and I got a call from my doctor's office and my heart just like dropped because I didn't know why they were calling. And my doctor was like super cheery and just like, oh yeah, your gestational diabetes test looks great. Have a good weekend. And so it was ultimately a really good thing.
It was just the time she was making those calls,
Scared
which
me.
is like but it's a pretty random call. 5 on a Sunday is a pretty random time.
But we also had our appointment this week when I went in to do the gestational diabetes test, and the ultrasound looked really good. The baby's measuring on time. He was 1.5 pounds, so a little ahead of the
averages.
A little ahead of the average for this week. And overall, our doctor was just really positive about how everything's looking, which was so reassuring. We talked a little bit more about the velamentous cord insertion that I've mentioned before on this podcast. So this was the first time we saw our OB in person since going and getting our anatomy scan at week 20. And so we hadn't been able to talk through the anatomy scan with our OB yet. So during this visit, we unpacked what they saw. She was really optimistic because the velamentous cord insertion looked like it was marginal, which meant it's not fully on the outside membrane. It's just right on the edge. They won't know for sure. We won't have a definitive answer until I give birth and they can actually see the placenta. But overall, she wasn't concerned and was really positive about it. So it just was a really reassuring visit. That seems to be my word of description for this visit, but it really was.
It's really nice when you get more information and they get more data, and the more data makes it better, not worse. That is really reassuring when that's the case. Yeah.
We have time to sort this out, but she brought up the possibility of inducing again, which is what we did the first time around for different reasons, but nothing's been decided yet. From my understanding of her thought process on it, it's just so when my water breaks, they could monitor it in hospital, hopefully, versus doing it at home because of this velamentous cord insertion situation. But that said, it's still open. We have not made a decision yet, you and I. She was just sort of floating it as something to consider. And I think as we progress in the pregnancy and get more information, we can make an informed choice about that. Something that was really positive, and for anyone out there who's in a second pregnancy or subsequent pregnancy, she was really encouraging that the second delivery tends to be faster and easier, which are words that I love to hear. So she was saying that your body already knowing what to do is more prepared for that. Her patients never believe her until they have their second, and they're like, oh, it was easier. But something that I was happy we talked about was from when my water broke in my first pregnancy through transition into pushing, there was like about a 45-minute gap, which I guess for a first pregnancy is a pretty fast turnaround. And because the second pregnancy could be even faster, she said to make sure to inform nurses upon intake or when we start, getting into a hospital room that that's the case so everyone can be prepared because it could go really quick. And then this week, we also had our 3-year anniversary, celebrated 3 years.
Mm-hmm.
How many years does it feel like?
Well, I think it's COVID, stretches time. I think 5.
5 years. Yeah.
I think 5.
Yeah. Which is shorter than the time we've been together, but longer, obviously, than we've been married. Mm-hmm. Did you just feel like you met me and were instantly married to me?
Instantly magnetized to you.
Oh my gosh. You've heard it here first, folks. It's on the recording. I can play this back. So this week you went out of town. Our first time where you went out of town for a stretch since our first son was born. Mm-hmm. And the first time that I was really on my own for a week. Mm-hmm. There's definitely some anticipation there, especially being pregnant. Yeah. I don't think there would have been as much anticipation had I not been pregnant at the time.
Oh, for sure.
Different, but went really smoothly. So I guess get out of the house more.
It was really great that we had the appointment where we got a lot of reassurance and a lot of great feedback the day before I left. The tone and the vibe when I left was very good.
Pretty solid.
We were in a positive place.
Yeah. And then other than that, I'm just feeling so pregnant now. Like my belly just feels so big and I just feel like in it, which is so silly to say because I am obviously, but it gets to a point where it's just like undeniable and it really affects everything. And I feel like I'm at that point. Just for the sake of vulnerability and honesty, I wanted to do a little disordered eating check-in here because, as I said, I am feeling so much bigger. And so I feel like because this pregnancy, my body is changing so much faster than the first time around, I've had to do some check-ins with myself and go, how am I doing mentally? How am I doing emotionally? How is this feeling? And overall, it's going to sound a little cheesy, but I'm proud of myself because I don't feel like I am gravitating toward even wanting to withhold or do any sort of even just mental behaviors that I usually do around that side of my life when I'm not in a good mental place.
I don't think it's cheesy to say you're proud of yourself.
Yeah, you're right. That's right. We should reframe that.
I'm definitely proud of you.
I appreciate that. Maybe the reason I say it that way is because I do know it's a daily journey and you're working on encouraging your brain to respond to things in a different way. And it's just something that I just feel really passionate about being honest about it because I think that though I feel really lucky that it's been easier in pregnancy for me, it's still something that can just be so isolating and so hard. So it's just something I guess I just want to always put voice to it because I think shame and silence are the things that really get toxic about this topic.
Hear, hear.
Okay, what did I Google this week? I'm really anticipating labor. So both of my questions are labor related. The first is what percentage of people tear while giving birth? And this says the majority of pregnant people, up to 9 out of 10 people, will tear to some extent during childbirth. Most people need a couple stitches to repair, and most tears occur in the perineum, which is the area between your vagina and your butt. But I actually tore the other way.
Oh,
I didn't tear up and down like that. I tore side to side.
right.
Yeah. So it happens. It happens all sorts of ways. But the tear wasn't terrible. So I'm hoping that I'll be on that same path, even if there is a little tear. It was less than 1 degree, they said, which I'll take. How can I prevent tearing? So I went to our friends over at the Mayo Clinic and got some information on preventing tearing. Dave, would you like to do some reading?
Oh, boy, would I.
About vaginal tearing?
Yes. I mean, you know that this is something I read up on all the time.
You know, I think it's good for you to read it because you can really feel the weight of the words, which is just a little tiny look into what we are feeling as people who are about to tear or could potentially tear.
Totally fair. Okay. According to the Mayo Clinic, there's no guarantee you'll be able to prevent vaginal tearing during childbirth. But some research suggests that taking these steps might decrease the risk of severe tears. Number 1, prepare to push. During the second stage of labor, the pushing stage, aim for more controlled and less expulsive pushing. Pushing the baby out gently and slowly can allow your tissue time to stretch and give way for the baby. Your healthcare provider will offer guidance. Ours definitely did during the birth of our son. Number 2, keep your perineum warm. Placing a warm cloth on the perineum during the second stage of labor might help.
Did not do it, but maybe I will try it.
Yeah, I was just going to say, we did not do that. Something to try. Next, perineal massage. During the second stage of labor, your healthcare provider might place 2 fingers of a lubricated gloved hand just inside your vagina and move them from side to side, exerting mild downward pressure. Your healthcare provider might also recommend perineal massage at home at the end of your 3rd trimester before the start of labor. You can do this yourself or with the help of your partner.
Did not do this either the first time around.
Did not. Last but not least, deliver in an upright, non-flat position. There are a number of delivery positions that might reduce the risk of vaginal tear during childbirth. Rather than lying down flat during delivery, deliver in an upright position. Your healthcare provider will help you find a comfortable and safe delivery position.
And that one we did not do either. I delivered on my back, but that one has a lot of variability based on how your labor is going.
Yeah.
So that one, I feel like you do your best. And
a couple of these, it feels like you could be proactive about them. A couple of them are more in the moment and we'll see how it's going.
Yeah.
It feels like.
Yeah. So that's that. Week 24.
Week 24, 6 months.
Our guest today is Dr. Rachel Davidson. I loved this conversation and it gave me so much to think about. She is a professor at Hanover College and has a real passion for looking at how motherhood is represented in pop culture and investigates how that encourages society to value and devalue motherhood and mothering. There were so many wonderful takeaways from this conversation. She's also the mother of 2, and she opened up about some of the struggles her family has gone through and how they have navigated that together. This conversation was packed with beautiful vulnerability, incredible insight, and I can't wait to share it with you. So, let's do this. Well, thank you so much for being here with me today.
Thank you for having me. It's so good to see you. I wanted to ask how you were feeling too.
I'm good. I just have gotten to the phase where I'm feeling a lot more kicks, which is always fun and reassuring. So as I've been prepping, I've been getting little like, hi, I'm here, which has been nice. But it also means pregnancy brain.
I feel like I still have pregnancy brain, and it's been, 17 years. My youngest will be 17 this Friday. So
I think we can embrace pregnancy brain for the rest of our lives after we're pregnant. I'm fine with that.
I think if you give birth, yes, you have the right to claim pregnancy brain forever. I also stand by, I tell my kids on their birthdays, I think we should celebrate the moms, actually, because we're the ones who did all the work on their birthday.
You know what? I didn't realize how big of a deal someone else's birthday would be for me until I had a child. And then I was like, oh, I remember going in.
Yes.
Like, you have all of those visceral, it's really... Again, I have chills. I'm so emotional.
I am too. And you want to relive it. Like I just want to, every birthday, retell those stories. So
yes,
I love birth stories.
Yes, birth stories. And I think they're important to share. So to start off, do you mind telling me a little bit about the work you do?
So I just feel like one of the luckiest people in the world. I love my job. I am an associate professor of communication at Hanover College. And it's a teaching institution. So my primary job is teaching, but it's an academic appointment. So I also get to do research, which I love. I kind of came into research late in the game. I thought I would always be just a teacher. I don't know why. And then during my master's, I started researching motherhood and I just fell in love with it.
What attracted you to studying motherhood?
Going through graduate school, so working on my master's, my oldest daughter was going into kindergarten. And I remember putting her on the bus for the first time. And I just remember feeling elated, just totally excited because I was going to have extra time to do my schoolwork, like all day. She was going to be gone. I was super excited. This was in 2008. And the only reason I know that was, I think, around the first year of Facebook. And so I was new to Facebook. I decided to craft my own little Facebook post. Everyone started posting, mostly mothers, about similar stories. They wanted to share the first time my daughter or son got on the school bus for the first time and how they felt. And what surprised me the most was the emotional aspect in terms of tears. A lot of people just said, oh my gosh, did you just cry your eyes out? It was waterworks for me, or I couldn't do anything the rest of the day because I was so sad until they got off the bus that day. And I remember that was the first time that I really thought something was wrong with me as a mom. I did not experience that sensation at all. And so it really started off with that curiosity and reflecting on that moment because I felt guilt, mother guilt. And I wanted to figure out why. Like, I'm a good person. Like, there shouldn't be this guilt that I feel just because I'm excited that my firstborn child is going to kindergarten. So I went to school, I remember later that day, and talked to my advisor at the time, Dr. Catherine Jobres, and we talked about it. And her primary research focus was motherhood. And so I just started exploring motherhood. And then it ended up being the focus of my master's thesis. And I just have never been able to escape that topic.
That's incredible. I love that you got curious with the feelings that came up for you. I would love for, I'll speak for myself, but then also in general, for us to be able to apply curiosity more to some of the emotions that come up for us, especially around motherhood, because I think that feeling that judgment and thinking, am I different? Am I bad for not having the same reaction can be such a go-to.
Yes.
How do you feel like these images of motherhood or what we think that, quote, mother should be like influences the way that we talk to and treat ourselves?
In my research over the past 10 years, I've really found that this good, bad mother dichotomy is pretty commonplace. The problem that happens is when you have this good, bad dichotomy, we're limiting our options of what constitutes a good mom and then what constitutes a bad mom, right? And so if we have only these two polarized depictions, it's impossible for real life mothers to achieve the standards that they're seeing in that good mother representation. And, and the good mother representation can look like a lot of different things, but primarily we see, mothers as primary caretakers of their children, mothers who are child-centered, so put their children's needs ahead of their own, which is important. I'm not saying that you shouldn't do that, right? But kind of like their sole purpose in life then is to put the needs of their child ahead of their own as a mother. And then also a really awesome scholar, Sharon Hayes, she coined a term called intensive mothering. And she said this was the predominant model of a mothering ideology in Western culture. And so she said what she found in her interviews is that mothers were trying to achieve their good mother status by fulfilling these standards or expectations. So I'm the primary caregiver. I put the needs of my child ahead of the needs of my own. I spend countless hours, physical labor, mental labor, and lots of money into my parenting. And so it's a really interesting thing. A lot of scholarship on motherhood now will kind of talk about that intensive mothering model as a way that real life mothers then measure themselves against, right? Here are these unrealistic standards that are meant to keep women and mothers out of power, essentially, is what that is.
That's fascinating. You mentioned that's sort of maybe the idea of, quote, good mothering. Will you talk a little bit about what bad, quote, how it's represented in media, bad mothering is or looks like?
It's pretty simplistic because we have that binary. So it's everything that the good mother is not. And so, and there's different ways that different archetypes, I would say, in popular culture narratives that takes. Sometimes it's, just putting a mother's needs or desires ahead of their children. So women who, cheat on their spouses or, maybe who abandon their children, even if it's in their child's best interest, kind of those types of things. There's different language that scholars have used to describe that. Monstrous mom is one that comes up a lot. But essentially someone who is not putting any effort into their child's sustenance.
Having that binary and knowing that nobody is all one thing or another, what are we missing from the conversation or representation?
Part of it is just complexity in terms of representative models of mothers. But I think also, one thing that I would love to see more of in popular culture are community and friendship models of parenting. So it's not just mothers as primary caregivers, fathers as primary caregivers, extended family as primary caregivers. And not only that, so it's not just that representation might be there, but that the representation doesn't ask us to value that or devalue it as good or bad, or to assign like, this is good, this is what I should strive for, this is bad, if that makes any sense. So like my master's thesis, I looked at representations of like deviant mothers or monstrous mothers. And I was really interested in the ways in which film in particular can offer perspectives or can offer these representations of motherhood without saying necessarily, this is a bad depiction or this is a good depiction. This is just what it is. And so offering a perspective or kind of a character study on a complex mother that we used to maybe call a flawed character, maybe isn't so flawed and is just a mother, right? So there was a feminist scholar who studied motherhood, and her name's Adrienne Rich, brilliant scholar. And she distinguished between mothering and motherhood. What she said was there's mothering, and all that is the relationship of the mother to the child.
Mm-hmm.
The other thing that she distinguishes is motherhood as an institution. It's what she calls a patriarchal institution. And that's where the expectations and standards come into play. And so it's easy for us to say, here's what a good mother is, here's what a bad mother is, but that's really not mothering. Mothering can be anything. Mothering is just your relationship with your child. But the motherhood as institution, that's what I think needs to change in those representations. So more depth in how we portray mothers beyond just good, bad. So transcending that good, bad binary. Part of the patriarchal institution of motherhood is normalizing the ideas that all women want to be mothers. And the other, part that gets normalized is the idea that we all come equipped, women. If you have a uterus, we come equipped with this maternal instinct, which is really a myth. Some of us might have that, and that's wonderful. But those ideas become normalized in a lot of ways that we use to describe mothers, portray mothers, evaluate mothers. Those can be really problematic. Like for me personally, I thought I was just destined to be a mom. I thought I would be amazing. And I thought I would love it. And I was just really shocked when I didn't have that maternal instinct right away. It was not even right away. Like, I don't feel like I've ever had maternal instinct on anything.
It makes me think about the concept of trust and like how much can we trust ourselves? How much can we trust what's inherent in us? How much can we trust the signals our body is or isn't giving us? And then how that opens up society to say, like, I know a lot of women who don't want to be moms and they get a lot of like, are you sure? What if you change your mind? As opposed to just trusting that this is something you know about yourself, or maternal instinct. I don't feel maternal instinct. Then can we open the box of what does that mean? And what does my parenting look like because of that? Or is it just like, oh, are you a good mom? Or are you a bad mom? So it brought up the concept of trust to me and how it backfires on yourself because of external expectations. Do you have any thoughts on that?
I have to say this to myself all the time. Trust yourself. Trust that you know what you're talking about. Trust in how your body feels. Trust in what your body is telling you and what your mind is telling you. But I know another part of that intense mothering model that I didn't bring up is the idea that good mothers are supposed to consult expert guided opinions to shape their parenting. And so I think inherent in this like patriarchal model of mothering is the idea that we shouldn't trust ourselves, that we need to consult experts. And, experts aren't just Dr. Spock, right? They can be child rearing manuals, but experts can also just be, your mother-in-law. I think that is something that we need to be curious about when we're not trusting ourselves, or if we feel that trust, like to listen to that inner voice. Absolutely. I think that there are lots of constraints in public discourse that are going to get you to try to question your ability that you can be a good mom, and to push back against that, I think is really, really important. That's so smart. I love that you brought that up.
It's another example of motherhood not being binary, because it's remembering that then hopefully you do have a supportive community around you. So if and when you want to reach out, that hopefully is available to you, but it's not, you don't always need the feedback or don't always need to consult in order to land on a decision, trust yourself, etc.
Oh, yes, absolutely. I think that's really important. And honestly, my thoughts on community have to deal with my personal experiences in our family going through a crisis. And I didn't really know what community was or what community felt like until our family was in crisis. And then I just almost kicked myself for not asking for help sooner, right? And I don't mean just, community in terms of extended family, but community wherever I could find it, whoever was going to listen to me and to help. It's not a weakness, to ask for help. You know this. Right. I know I've listened to enough of your podcasts. I know that you know that. But, part of what motivated me to study motherhood and then other issues like it is motherhood is it comes in different forms. And what I mean by that is if we think about a simplistic public sphere, private sphere model, like public sphere, things that happen in the workplace, things that just happen out of the home versus private sphere, anything domestic or that happens in the home. What we tend to see and what we've seen over our history is anything associated with that private sphere gets devalued, right? And so and mental health, anything that's individualized that we, put in this little house bubble, that's something that you have to deal with individually. And that doesn't have a place in the public sphere. And a lot of that public-private sphere separation is part of the root, I think, of some of these problematic patriarchal motherhood ideologies. But it's not just in mothering, because there's so many issues that need to have public sphere support. And I think, too, those public and private sphere distinctions get gendered all the time. So what is public typically and historically has been those things associated with men and boys, and then private sphere associated with women and girls. So it's easy and problematic to go back and kind of trace back the devaluing of what is private, what is domestic, what is woman versus what is lifted up in our society, those things that are public.
That's so fascinating. And I think there are so many examples, speaking specifically for the kind of like woman to man dichotomy. I go like, yeah, there's so many things when I think about just womanhood where it's like, can I talk about this? Am I going to make you uncomfortable? Is this too much? Certainly in motherhood, and then just womanhood. And I think it's a really interesting point to investigate, even how you bring up these topics, because I find myself going like, my example recently, because it's something I'm dealing with pregnancy, is like I've been talking more about discharge because it's something on my mind right now. And I think it's important in this context to talk about it because it's very, very normal. But then there's always that feeling of like, am I going to make you uncomfortable? Is this too much? But it's like, we all experience it. It's super, super, super normal and it's healthy. And so it's like, I think it's an interesting check-in with yourself of being like, yes, there are lines to socially understand because there are sometimes contexts where you can't put information out there because it's not appropriate. That's normal. But when it's gendered or when it's about politeness or it's about, oh, I really shouldn't, I just think it's a good check-in with yourself to think about.
And a lot of women, we can't do a good job of performing our gender identity, which a lot of times is directly tied to that mother identity because of the essentialization. Every woman should want to be a mother, right? And I see this in the classroom. Another topic that really interests me is how we take our mother identity and put it into different contexts, like an educational context. So to what extent do I mother my children? To what extent do they expect me to be their mother? I've had students who tell me, and very earnestly, it's so sweet, like, come to see me after hours because this isn't about class, but this thing happened and you remind me so much of my mom, and can I just talk to you about it? But I also think that one reason that I might get positive evaluated as a teacher is because I do a good job of meeting my students' expectations about my gender identity and about my mother identity. And so there's definitely a performative aspect there, but I see that performative aspect as part of putting the needs of my students or whoever you're communicating with ahead of my own, right? So instead of me just talking about discharge, I'm going to say, wait a second, does this person want to hear about this right now? I'm putting their identity needs ahead of my own. And that's a very gendered mother issue. It's so fascinating.
Right.
It's like everywhere we turn.
Is that how you feel like you find the balance? It's by at least making a choice of like, I am going to be inside of the performance of my gender, and therefore I'm making a choice about how I'm engaging in this situation? Or what is the road for you to kind of find a balance that feels both authentic and also not like you're just living inside the pressure of expectation?
I think that for me, it doesn't feel like too much identity work to achieve that balance of authentically performing an identity that I think that I am. But I would say, I don't know, because I feel like women are socialized to make others feel comfortable. And it's hard to feel like, is that not my authentic self? Or am I just doing this because this is what I have learned since I was, a little baby kind of a thing? It's hard to say because we're so entrenched in those societal expectations.
Yes.
So in a weird way, I almost feel like I don't have to balance it, just like kind of comes intuitively. And I recently, over the past year, did some research where a colleague of mine, we interviewed female identifying faculty members and asked them about this mothering issue in the classroom.
Mm-hmm.
And we also asked them to, identify if they were mothers or not mothers. And, what we found was so interesting that all of them almost emphatically said, yes, I definitely mother my students. Some of them called their students their children. They also provided some justifications for why they did that. And they say things like, well, it's just me. It's just my personality. But all of them said that, like, it's me, it's my personality. Like, that seems more of a gender issue to me, not, and I think a lot of it can be personality too, but it was a really fascinating finding, regardless of status of if they had children or not. This is how they saw their teaching role. And kind of the way they described it was teaching is not just like a transactional thing. I'm the teacher, here the student, here's this content, but there's an emotional labor part of it.
Right.
And not only does that exist, but most of them said things like, it should be. Teaching should be an emotional endeavor. It's not just about the classroom.
Yeah.
It was very maternal. I mean, this was about the fostering and the supporting and including and building these relationships with students in a way that just seemed so parental.
It brings me back to when you were describing the definition of mothering and the relationship, and it feels like it's very much in line with that.
Yeah, and how empowering it can be. And it shouldn't be embarrassing, but it kind of is. But I feel more competent sometimes as a teacher than I do as a mom. And I probably am not. I think I'm probably a really competent mother as well.
Yeah.
I apply those same problematic standards to my own parenting. And you think after studying it for years would be resistant to it, but I'm really not. Yeah, I feel very competent in being able to establish connections and to foster growth and learning in the classroom in ways that I question myself in the home.
It's so funny you bring that up too, because I was literally talking about the word and meaning of competency today with my therapist. And that feeling of like, it's not having it all figured out. It's just knowing that you can meet the moment. And I think that motherhood is one of those things where when you're feeling in your most flow state, you're like, I think I'm here. And it's like affirming in a way, for me, I'll speak for me, for my entire identity in a way that like really floored me when I first experienced it. And when that's not there, it's like the most scary kind of judgment-filled swirl. And I just think that's really interesting, that the role and idea of like, can we claim competency as mothers and feel that fully? Or is that kind of put in this like unattainable category because we are still trying to match the perfect, good mother image that is unattainable?
You just gave me an aha moment. When you talked about competency as meeting the moment, for me, I immediately thought of control. And that I am able to control a classroom. And, 105 minutes, I can plan it. I know my discussion questions. I know the content. I know my students pretty well, right? So there's an element of control that I have over that situation, which totally makes sense then that my competency might feel higher than an absolutely out of control. Like you can't control things, motherhood. Like it's being in the moment. And, for someone like me who likes that feeling of control, that makes me feel safe. It makes total sense why I would feel like I'm not as competent in my motherhood role because I can't control it as much.
It brings me back to that idea of just like trusting. Like, so can we trust that like I can be out of control and still feel comfortable? I think that's, it's just something I'm fascinated by. And thank you for bringing that up and talking that through with me. You mentioned going through crisis in your family and on a personal level. Do you mind talking to me a little bit about what that experience was?
Yeah, absolutely. a couple of years ago, my oldest daughter, who I've received permission to talk about this, but my oldest daughter came to me and said she thought she had an eating disorder. And it was something I had no experience with. I didn't know anything about it. And the last couple of years, it's pretty much turned our family upside down, but sometimes in unexpectedly good ways. We've learned a lot about ourselves, learned a lot about each other, just going through therapy and different treatment centers and trying to understand her specific needs and just trying to understand what it means to have an eating disorder. And it changed the family dynamic. But again, I would say that in ways, it definitely brought us closer together and we have a more functional relationship where there's really no topics that are off the table. You know, we have just laid it all out there. And so I will speak not to my daughter's eating disorder and her personal experiences, but as a mother of someone who is going through that was horrendous because I wanted to fix it. I wanted just to swoop her up and take all these things away. And it's impossible. You can't do that.
Right.
And so my mother identity changed. And also it changed in like practical ways because I felt like I couldn't just be what we might think of as a good mother in that situation as just nurturing and compassionate and listening and being patient. I mean, I was frazzled at every moment because I was trying to figure out, you know, the eating disorder world is part mental health and therapy, part medical, psychiatry, insurance. I mean, and there's different levels of treatment for eating disorders. I mean, I had just no idea what I was doing or how to get, you know, my daughter the help that I felt that she needed. And so, you know, it was just like, I was a mom one minute and then the next minute I'm like a case manager, just trying to figure out and retelling the story, you know, over and over, just begging people to help and getting so many no's. And it was so difficult to get treatment.
Yeah.
Like I'm lucky because I feel like I have the time. My job affords me the time. I have the resources and the means to be able to do this, but I'm one of the lucky ones, right? There are so many people who can't do this for their children, and it just like really broke my heart, you know? And so I keep telling Carolina I want to like write a book with her that's kind of like a field guide for parents and, you know, navigating these waters. And it's always was kind of a one step forward, two steps back. And so it never really felt like things getting better. Like, is this, you know, is my effort working in this area? But then looking back now over the last 2 years, it's just, holy cow. I mean, it's amazing to see the growth in the healing and recovery of not just our daughter, but the whole family.
Absolutely. Was this something that was a surprise to you when it was revealed, or was it something that you sort of suspected, or what was your relationship with kind of the initial unpacking of what was going on?
It was a total surprise. And this goes back to that me questioning my maternal instinct. Like surely she was very, very sick. And surely as a good mom, I should have noticed these things. And there were lots of signs. And as I started to be educated about what eating disorders can look like, it's not just one thing and it's very complex. I started piecing together these puzzle pieces like, oh my gosh, I noticed that back several months ago. And then this, and it's still, you know, I'm just really grateful that I had a daughter who came to me because I've just heard, you know, a lot of people just struggle with this and want to figure it out on their own. And I just was thinking about that. And I was talking to my husband about it just a couple of days ago. That's how amazing of a person she is, that she was able to recognize that there was a problem, articulate that, and ask for help.
That's incredible strength.
It's incredible.
The reason I ask is because I wonder about how you took care of yourself going through that. And then also trying to hold space for her recovery, and not put your experience on top of her recovery experience. And I'm just wondering how you took care of yourself while also navigating that discomfort of watching your daughter be in an uncomfortable place.
Yeah, I definitely did not take care of myself very well. The first few months, I started to reach out to people to help me fill in the blanks. Like, I've seen a post that you made on Facebook about this eating disorder. Will you talk to me about it? And so I started kind of doing that, but not really telling anyone. I didn't tell any family, we really kept it kind of like a family issue, which was not good. And so
Mm.
she went through several months of treatment. And I, again, just thought, okay, this is working because I'm not hearing anything bad. And then a few months after that, she came to me again and said, I have been just kind of going through the motions. Like, I'm okay when I'm, talking with
Mm.
my therapist and my dietitian, but I'm really just telling them what they want to hear. And she was doing the same thing with us, and not in a deceptive way at all, but just in a way that
She's in her illness.
she was very deep in her illness. And she said, I think I need residential treatment. And then
Mm.
again, another layer of mother shame, because it just went over my head. I thought everything was fine. And then, beating myself up, for that. But at that point, that's when I feel like things kind of got to like crisis situation, because residential treatment was just a completely different world. And so I needed
Mm.
help from anyone who would hear me. So with Carolina's permission, I started telling family, my colleagues, and that was so therapeutic for me, just sharing that
Mm.
story. And it was just like a continued line of therapy for me, because once someone knew, then they would ask me, how is she doing? And you know what I
Mm.
mean? And it's
Mhm.
just really important. I would say, as a parent, for me, it was very important for me to be able to talk about it and not hide it. And
Mhm.
for several months, I felt like we were living this weird double life, like on the surface, talk about performance, right? Like on the surface, here's what everything's fine. And,
Right.
but really internally, we were just falling apart. And so there was just something about sharing that with so many different people. And then at that time, I started to reach out to different eating disorder treatment centers. And
Mhm.
I can't tell you how comforted every place I called made me feel, because I would share
Mm.
Carolina's story and they didn't rush me. It was just they listened. And even if they couldn't help me, because, there's rules like, oh, she's under 18, or it's not in our in your network or whatever, they were just so kind and helpful, and would continue. A lot of them continue to reach out to me. Like, I know we can't help you, but
Mm.
call this place. I mean, it was just a beautiful, lovely network of people. Oh, and they just saved our lives. I mean, it was just amazing.
That's incredible.
Yeah.
You mentioned that this really changed and shifted some of the dynamics inside of your family, and I'd love to
Hmm.
hear anything that came up for you inside of that. But specifically, you mentioned communication, and now you guys are at a place where it feels like you can really talk about anything. What do you think you did deliberately, or what have you put in place to make a safe dynamic for communication in your household?
We did a lot of family therapy, which was new to us as a family unit. And so that really allowed us to open up the communication lines with each other.
Mhm.
But also, Carolina was in a residential facility the first time for 4 months, and just her being gone was really, really difficult. She didn't have a phone to use, so we just wrote a lot of letters, and it was just this constant of pouring each other's hearts out using snail mail. So one of the biggest, and I think probably one of the most important relationships in the house was between Carolina and her sister, Ivy. And
Mm.
so they are only 21 months apart, and they have not always been the best of friends. But the first time Carolina went to residential was like changed their relationship, and they have
Mm.
become a lot closer because of it. And it was through just, I think, being separated from each other for the first time. So I think that my daughters gave us a good lesson. My husband and I, when
Mhm.
they have conflict with each other, we need to stay out of it at this point. They're
Mm.
adults. Like, we need to let them figure it out, because they do. They started telling us that several years ago, but that's just been something that really helped just the overall family dynamic with us. As long as
That's
you're not
great.
hurting
That's
each
that's
other.
a Yeah. Yes, absolutely. And it's you as a parent being able to bear the discomfort of your kids are not
Yes.
in their most happy state. And can I stay out of it and allow that to happen? Because I know they're safe.
Yes. Yeah. You have to really try to separate yourself from, I'm the problem solver, I'm the mediator, and I'm going to fix this. Because you can, as a parent, you can see things that your children probably don't see. Like,
Right.
you just
Right.
want different things from each other, but they do need to figure that out on their own, and that has been really helpful.
Having a daughter who's going through a crisis and that crisis clearly affects the whole family, what has it been like to be there and show up for your other daughter? Because I think
Mhm.
sometimes in those moments, it can be challenging to balance both, especially when the stakes are so high.
Yes, 100%. And that is what my husband and I talked about a lot when, especially when Carolina was gone. We were like, we really
Mhm.
need to shower Ivy with just love, attention. What is your love language, Ivy? And okay, let's fill your tank, especially while she's gone. But I think
Mm.
also, one thing that we always have done is always said, kind of like at a meta level, like, we realize, Ivy, that this is hard. Like, your sister is gone and she's struggling with something
Mhm.
that is really, really difficult. And we know that this is difficult for you. And so I think just acknowledging that over and over verbally to her was really helpful. Didn't always take away like the pain or
Of
whatever, but
course.
I think that was helpful for her. Ivy never really wanted to talk those things out loud.
Uh-huh.
When her sister was gone, she just wanted us to watch a movie with her. And so figuring out, I think, the needs of each of the kiddos was just something we just had to constantly be aware of. Or if I felt like I was giving too much and it was a little out of balance,
Mhm.
I would try to pull myself back over to Ivy, talk to her about it, apologize, and what can we do to fix it?
Yeah, because nobody, hopefully, we're teaching our children that we're not perfect, but we
Yeah.
can take ownership. We can be there. We can show up. We can have conversations about these tricky things. So it sounds like you
Hmm.
really opened the door for that. And then she can meet the moment in any way that feels best for her. That's her choice.
Yeah.
That's wonderful.
Yeah.
What do you think is the biggest misconception or something that you think is maybe under talked about a family who's going through an eating disorder or even broader, potentially just a crisis?
The thing that I have learned that it seems to be under discussed is just how normalized disordered eating is and how
Mm,
normalized diet culture is. I never really observed it, or I never really didn't draw my attention until Carolina was going through this. And as I was learning about eating disorders, just started seeing disordered eating everywhere, and not even just seeing it, but just like
yeah.
praising it, or like, this is a good thing, and different aspects of diet culture. So it just seems impossible to escape, even at family functions. I mean, it's just,
Hmm.
it's difficult. So for a while, we tried to shield Carolina, from that while she was going through treatment. But then we just realized, like, that's really impossible. And maybe we're doing her a disservice, because
Yeah.
I wish I could promise that you're not ever going to see this, or you're not ever going to hear someone say this, but you're probably going to. And so I think it's better to talk about the tools that we can use to reappraise, or to
Hmm.
talk through that when that happens, as opposed to just trying to erase it from its existence, because that's a big social problem.
It's just so out there. It's everywhere. It's inescapable. And I think
Hmm.
you bring up a really interesting aspect where it's like the balance, especially with parenting, of like how much do we shield our children and how much do we prepare our children?
Hmm.
Because again, it's that feeling of like we will never be able to take away the discomfort. So how do we approach these difficult topics?
Hmm.
Okay, so you teach gender studies as well,
Hmm.
right?
Hmm.
We talk a lot about gender right now and how to talk to our kids about gender. What is something you think parents can do to open the door to healthy gender conversations?
One thing that I have done since the beginning of the existence of my children, I do not shield them from media. I am a media junkie, a popular culture junkie. I consume lots of popular culture, and I think it's exciting that they do it as well. What I always have asked is that it's okay for you to watch this, but we're talking about it after.
Wonderful.
Typically, what we talk about are things like the portrayals of men and women, and how those portrayals are valued. How are we supposed to feel about that character? And why do you think? So just asking questions and getting them to be these little mini critics like of popular culture, I think is a better, more effective approach in preparing them to be critical about the messages they receive, as opposed to just saying, nope, you can't do this or you can't watch this. Now, I did not let them watch really inappropriate things at a really young age. But when things were age appropriate, I can tell you one of the first analyses that we had was the Twilight series. I'm not going to lie. It was fun. And I tell them, and I tell my students this too, you can enjoy these artifacts that you pick apart and critique, right? You can find pleasure and joy in consuming these artifacts, but that doesn't mean that we have to be a passive audience that just lets these, ideas and messages wash all over us. Well, we can ask questions and be curious about those things. So I do the same thing with my kids.
That's awesome. That's really great. What is mothering shame? What is mothering guilt? Why is it important to know the difference? And how can we talk to ourselves more gently when it comes to both places?
So I love Brene Brown, and I have just gotten so much out of her writing and teachings on difference between guilt and shame. So guilt, I've done something wrong. Shame, I am wrong or I am bad. And so when I learned that distinction, those instances where I used to categorize as mother guilt, I really feel like for me personally, a lot of those things were shame, mother shame, because of the impact. When Carolina got on the bus the first time and I was ecstatic, I felt like the responses that I got made me feel like I was a bad mother, not that I did something wrong. You know what I mean? So I do think there's something really interesting about that, because the impact of shame is so severe and sometimes inescapable. And it's hard to trust yourself and talk yourself out of, I'm a horrible mom. I can't believe I just, this wasn't just a one-off. I made a little mistake, but I'm a horrible mom because of it. Those labels that we put on ourselves can have really detrimental impacts on our mental health and in our relationships with others and our capacity to feel competent in our mothering.
Yes, absolutely.
Pulling everything full circle.
Bring it all full circle.
Yeah.
What can we do if we start to feel that shame? Do you have any tools or anything you go to?
I'm going to sound like a broken record here, but being curious about that label. So if you start feeling, and I'm no expert, okay? I'm not an expert on this. Just based on my experience, I would say, if I am experiencing something negative, I'm having a negative physiological response to something that I did or said or whatever, first labeling, like, is this guilt or is this shame? And trying to understand what might be behind those labels. And it might take talking it through, someone, or it might just be, journaling or just sitting and meditating or taking a walk and just kind of in your own brain, just thinking through, why is it that I'm having this kind of response? What does that mean? So I would just say, just being curious about your responses to things and knowing that being curious might allow you not to feel trapped by a certain label.
Yeah. Well, it's so interesting too, because as you were talking, it made me think of what we were talking about earlier, where it's like, it's very easy to take on the negative as truth in ourselves and be like, this bad thing, but it's a lot harder to feel like, can I feel true about my competency or something positive or this moment that was good? And so it feels like we can trust the negative more than we can trust the positive.
And the negative for many of us outweighs the positive. So when I'm looking over my course evaluations at the end of the semester, I can have 99% positive feedback, but it's that one that I'm just like, Oh, that I'll think about that for the next whole semester. And that can bother you. Yeah. But I think too, there's also some gender isn't the only explanation of, for everything. It's just my go-to because I consider myself a gender scholar. But something you were saying earlier made me think about gender, and that I've always felt uncomfortable just as a person. This is pre-professional Rachel, but just always felt uncomfortable bragging about something positive I've done or tooting my own horn about something. I just always thought, well, that's impolite and that might make someone feel less than, you know what I mean? So it could just be me, but I think there might be some, inklings of gender there as well. And so if you are feeling guilty about something, it could just be that maybe you're challenging some kind of stereotypical gender norm, and that's actually okay. But it's good to kind of think through, you know what I mean? So sometimes the feelings that are behind that might be like, oh, I just put my identity needs ahead of this person and they didn't like it, but it's fine. I feel good about who I am.
That's okay. Yeah, I can sit through this experience and accept this. Yeah. The accepting too of like a positive, accepting a compliment, accepting anything like that is really hard. And it's a practice I'm trying to work on. And I have really noticed too, it's much easier for me to accept something positive when it feels like work-based and much harder when it feels something like visual or something that feels like, and so those are some of those interesting ones to investigate too, because then I also am telling myself like, why am I worthy of one or not the other? It's just, there's a lot of curiosity things. I think there are lots of questions you can have inside of here.
Compliments that I get as a mother or, my mothering ability, I would say I'm very quick to point out things that, oh, well, you didn't just see me though a minute ago when I was, pulling my hair out and you don't see all the laundry sitting behind me or something like that. I need to get better at that. So if you have tips for me, I need to learn how to better accept compliments. I am not good.
It's so hard. But it's hard. It's hard also not to like reflexively go, oh my God, but you're so good at this.
Yes.
And can you just sit in the, it's all complicated. It's hard. Where can people find you?
I think probably my Google Scholar page, and it's just Rachel D for Diana Davidson. And there's a few Rachel D Davidsons, but I'm the one at Hanover College, Associate Professor of Communication. And there you can find a list of all of my publications. And, you can also find me on the Hanover College website if they have, a question or someone wants to reach out to me. That would be totally cool as well.
Well, thank you so much for being here. This has been so wonderful. I've loved this conversation so much. And I just appreciate you taking this time so much.
I appreciate what you are doing and putting some amazing conversations out in the public sphere. So this is great.
Thank you so much. That means a lot. Thank you.
Yeah, no problem.
That's me practicing taking a compliment. Thank you so much for listening to this week's episode of Week by Week. Please subscribe, rate, and review wherever you get your podcast. Follow us on Instagram at Week by Week Podcast and visit our blog at weekbyweekpodcast.com. Check out the show notes for more information about our guests and additional resources I used and referenced during this episode. This podcast was produced during the COVID-19 pandemic and recorded remotely. Our show today was produced by me, Celeste Busa, Dave Hill, and Douglas Sarine, and produced and edited by Colleen Beasley. Week by Week is a Gumption Pictures production.